AMH is often misunderstood. Many women think that AMH can decide whether they can get pregnant or not, but that's not the full truth. Now let's start by talking about the key fertility tests: AMH, AFC, that is antral follicular count, and then ultrasound. AMH is a hormone basically released from the primordial follicles. So AMH tells you about the quantity of the eggs rather than the quality. So AMH only predicts the response of your fertility treatment but does not reflect the quality of the egg. Generally, normal AMH should be between 2 to 4. Low AMH and high AMH could both lead to fertility treatments. So as your age advances, your AMH can fall. So because of low AMH, your eggs will lose the inhibition and they get destroyed fast. So low AMH will cause difficulties in fertility, and in PCOS you have high AMH. So this is the other spectrum of AMH. In PCOS you have lots of eggs. So this is a misnomer. These are not cysts but excessive number of eggs. So when the eggs are many, AMH is also quite high. So whenever there is high AMH, it is very difficult for the injections or for the hormones to act on the eggs and cause ovulation. So I would conclude that not only low and high AMH but also a normal AMH does not guarantee fertility, because AMH do not talk about the quality and only the quantity of eggs. So now AFC. What is AFC? Antral follicular count. So AMH, like I've explained before, it talks about the number of eggs in your body, but AFC tells you the number of eggs in that particular month. So your AMH could be low, but the scan in that month may show many number of eggs. So AFC is very important to start any form of treatment in fertility, be it natural or IUI or IVF. So that reflects your basic number of eggs in that cycle to start the treatment, and then that helps you to check the growth and the ovulation. So finding out your exact antral follicular count on day 2 is a very important thing. So AFC and AMH together can give you a better picture of your ovarian reserve. Next, talking about ultrasound. So what do we see in an ultrasound? We look at the uterus and the ovaries and any other abnormalities inside the uterus and outside the uterus. For example, you can find out whether you have fibroids or any polyps inside the uterus. And also in the ovaries, you can see if it's a normal ovary or a polycystic ovary, or you have any endometriotic cysts. Apart from these, you also can find out about any infection around the pelvis and in the pouch of Douglas. And not to forget, there's one more important test that is called SIS, that is saline infusion sonography, which in simple terms is called the tube test. So in the scan or with the AMH or AFC, you cannot find out whether your tubes are open or not. It is only with the SIS you can know about your tubes. So tubal patency is an important thing to conceive normally. If your tubes are blocked, there is no chance that you may conceive normally. You may have to go for IVF treatments. So all these tests will help the doctor to decide whether you can conceive naturally or need IUI, or you may need IVF, and also whether you need fertility preservation.